Stevie B's Media Production is a part of the Shellcaster Network.
The proclamation of the gospel of Jesus Christ by members of the Churches of Christ. With your host, Stevie R. Butler. You're listening to What a Word from the Lord radio show.
You are my protector and you are my provider and my deliverer. There's no other help I know. You are my protector and you are my provider and my deliverer. There's no other help I know. I really love the Lord. I really love the Lord. You don't know what He's done for me. Gave me the victory. I love Him. I love Him. And I really love the Lord. I really love the Lord. Really love the Lord. I really love the Lord. He saved my soul from sin. Love me again and again. I love Him. I love Him. I really love the Lord. And I know how sweet He's been. My deliverer, there's no other help I know. He's such a loyal friend. And on the cross, He bled and died. And now in Him I abide. I love Him. Yes, I love Him. And I really love the Lord. You don't know what He's done for me. Gave me the victory. I love Him. I love Him. I really love the Lord. You don't know what He's done for me. Gave me the victory. I love Him. I love Him. I really love the Lord. You don't know what He's done for me. When I think about His matchless grace, gave me the victory. I love Him. I love Him. I really love the Lord.
You're listening to What a Word from the Lord radio show.
Good evening, wherever you're in the world listening to this radio broadcast. Stevie B's Media Production presents What a Word from the Lord radio show. I'm your host this evening, Stevie R. Butler. And this radio show is being broadcast from Stevie B Media Production at the Carolina studio in the great state of North Carolina. Ladies and gentlemen, we are just grateful for the privilege to bring you a program where we as Christians and members of the Churches of Christ can share our faith and preach and teach the glorious gospel of Jesus Christ on a weekly basis. If you'd like to contact us while we're on the air this evening, just give us a call to the live show at 713-955-0508. Or you can go to the Blog Talk Radio website and listen to the show live there. You will find this show on page 321. I just checked the website before I came on the air, and it was on page 3. And normally when I go on the air, they'll move it up to page 2 or 1. That's normally how they do it. And ladies and gentlemen, if you have any questions or comments for any of my guests, special guests on this show or my co-hosts on this, you can send your emails to butlersteve1009 at yahoo.com, or you can call Stevie B Media Production at the Carolina studio at 910-491-6405. Now, again, this program is brought to you by members of the Churches of Christ. And if you need any assistance locating the congregation in your area, please feel free to contact us. Now, folks, every fourth Tuesday of the month, we have the Kelli Fletcher Show. Kelli serves with the Livingstone Church of Christ there in Indianapolis, Indiana. So enjoy your listening experience. Take it away, Kelli. It's all yours.
This is Terry Jackson, and you're listening to A Talk with My Sisters on What a Word from the Lord radio show.
Good evening, everyone, and welcome to everyone in our listening audience. I thank you so much for being here tonight. My name is Kelli, and you are listening to the Kelli Fletcher Show. According to, and I'm just going to jump right into it because I think our topic for tonight is an interesting topic, and we're planning to share, or my expert is planning to share, some significant information with you. So according to the CDC, in 2019, African Americans accounted for 13% of the U.S. population, but they accounted for 40% of HIV cases. My special guest for tonight will share some information that will give us insight on HIV and AIDS in the Black community, the prevention of AIDS, and resources. Should you have any questions for my guest after tonight's show, please feel free to send an email to butlersteve1009 at yahoo.com, and either he or I will be sure to forward your question to my guest. So without anything further, my special guest for tonight is Angelia Echols-Moore. And so, Angie, before we get started, can you please introduce yourself and just tell us a little bit about yourself?
Thank you, Kelli, and thank you, Steve, for this opportunity. I'm Angie Moore. I'm located here in Indianapolis, Indiana, and have been secondarily associated with HIV/AIDS, and specifically in the Black community, since the spring of 1990. In the spring of 1990, I lost a cousin. My family at that time did what most families of color did, and hide and hid what the reason for his death was complications from AIDS. I was not allowed to come home from college to go to the funeral, and we continued to hide and live in that dark space of what was going on. Fast forward to 2008, I began to do some grant work for IU Health and their HIV clinic, Life Care, and realized that although they are some amazing providers, learning how to serve those of color was a little different, and leaned in and found a whole other family of children and supports in that space. And so have been an advocate for those living with HIV and AIDS and those that are in the LGBTQA community since then, so since 2008, and push the envelope and have these conversations in spaces that are not normal, faith-based organizations that are led by individuals of color, and in spaces of education.
Okay, thank you. Thank you for that. Just telling us a little bit about yourself. And that will be one question that I'll tell later, about why talking about AIDS is such a difficult topic in the Black community. But again, I'll kind of push that down a little bit. And if you could maybe explain to us what is the difference between HIV and AIDS, and then talk to us about how is it transmitted from one person to another.
Absolutely. So HIV is the human immunodeficiency virus. It is a virus that gets into your body, and it does exactly what it does. It attacks the human's immune system, and it's not treated. If your viral load, the viral load of the virus is so high. So if you get a cold, there's markers for a virus for that. For COVID, there were markers for viruses, for those viruses. So if a virus is in your body, we see markers that show us how much of that virus is in there. If it gets so high, you're diagnosed with AIDS. And so AIDS is the acquired immunodeficiency syndrome, and it is just the fact that there's more, the level of the virus in your body is such that you can't fight off other infections. So one misnomer is that people die from AIDS. You don't die from AIDS. You die from complications or illnesses because your body cannot fight off the whatever else there is out there. So pneumonia, COVID, flu, all those things that we get and we are treated for. Someone with HIV would be at a higher risk. Someone with AIDS would be at an even higher risk of having complications or death from those. And HIV is acquired through bodily fluids, so blood, semen, vaginal fluids, breast milk. Those are like the key factors of how it is transmitted. So it is a sexually transmitted disease, but it can also be transmitted through breast milk. So in most states in the country, moms are tested for HIV so that we can, one, know how to deliver baby if necessary and get mom treated, and two, to know if we need to make sure mom is not breastfeeding if she has a virus and it is detectable in her bloodstream.
Okay. Why is it, both HIV and AIDS, why is it so prevalent in the Black community versus other communities?
So around 2008, when I came into the field professionally, the CDC switched from focusing on gay white men to Latina and African-American females. And what we learned was we were getting a lot of women of color who were being diagnosed during their pregnancy, and that was why we had the documentation. But what also has happened is that in the last 30, 35 years that we've been dealing with HIV and AIDS, we've learned that those who had insurance, those who were used to going to the doctor, and those who were complying with medication regimens were doing well. That happened to be gay white men. And so what we also know is that our criminal justice system, who has more men of color in it, was another place where positivity was happening, and so where the transmission was happening. And so men would come out, they would come home, they would resume their lives, and we don't test at exit, we test at entry to see if we need to treat them in the criminal justice system. We don't test, it wasn't common to test for the HIV virus when they came out. So women would have their men come home, they would engage in sexual intercourse, resume family situations and like roles, and mom would get pregnant, and we would find out during mom's pregnancy that she's HIV, and thus, we need to find out who else she's been with. And so the diagnosis was getting higher for women because that's where we were getting the testing done. But what we know is that men are diagnosed with HIV at a rate that is about 4 times that of women, and our young adults, 20 to 34, continue to be at risk for HIV with rates almost double that of other ages. And it's really around information gathering and risk. And the key part of that is having those critical conversations and those uncomfortable conversations in spaces that are unusual. So I've been doing HIV care now for 15 years, and so I have those conversations in every space. I sit as a school board commissioner, and so we talk about HIV and how are we making sure that we have available information and tools for students. Not that we're promoting sexual intercourse or utilization, but our needle sharing information is needle sharing drug usage is back up in the state, and so we need to be reminding kiddos that if they're using tattoos or sharing needles of any kind, that these are also avenues where blood will be transmitted or shared, and so that's a transmission risk. So anytime there's a risk, if we don't have enough education and we don't go get tested, then we can't get treatment. And so AIDS used to be considered a death sentence. If you got AIDS, then you were going to die. That is no longer the case. You can be diagnosed with AIDS. Once you get that diagnosis, it does not go away. It's like renal failure. It is one of the many diseases that the diagnosis itself is considered lifelong, no matter what happens to your viral load. So you can have been diagnosed with AIDS, get your viral load undetectable, but that diagnosis is still there. And so getting people to understand what is risk, because we immediately think of intercourse, but we forget that kids are, doing home tattoos or sharing, using drugs or sharing. Like, there's so many other avenues of entry. We don't talk about oral sex. We don't talk about, is that a possibility? If there's a cut in your mouth or if there's a tooth missing, like all those, any space that offers access to the blood system is an avenue.
Yeah.
Is it higher risk? No, but it is an avenue. And so we need to be, just relevant. And we don't have conversations normally in the Black community around sex, period, or sexual health. And so if we're not talking about general sexual health, we're definitely not talking about HIV and AIDS.
Right.
Can those individuals still live in our household without problems? Absolutely. I remember when I first started working in HIV, I was terrified to go to work. I had 4 kids who were often sick with colds and flus. I am more of a risk to my clients than my clients would ever be to me because my immune system is strong. But anything that I have on me or I'm carrying could affect someone that I'm serving. And I think, when we think about family systems, what happened to me is that my family did not want me to know that my cousin died from complications from AIDS. And so that barrier was there. So we didn't have a conversation. We didn't talk about, am I keeping my, like we didn't have any conversations. We just said he passed. Someone in the community or in the church finally told me that they thought it was this, and I got confirmation from my family years later. So we have to think about, why are we not having those healthy conversations? We talk about wearing a mask. We talk about washing our hands. Why are we not talking about ways to prevent and or eliminate risk around our sexual health as well?
Right. Why is it so difficult to talk about this in the Black community?
I think it's
why is it such
taboo.
a hard subject?
I think it's somewhat taboo. We've always thought of it to be something we should not do. It didn't stop anyone from doing it. We just kept saying we shouldn't do it, and so we didn't have the conversation. But what it did was it left us unprepared to deal with the realities, and our kids not understanding what risk means. And so when I got into this field and my kids were becoming teenagers, I was very open and honest about making sure they had the tools. I can't teach this to my clients and the patients that we serve and then have my children not be protected and prepared. And so it was a conversation, that I would have in church, or if a student or if a child asked me at church for protection, it was available. Like, moving some of those barriers around things that are taboo for us. Mental health is still taboo. So we put these blockages up, assuming that if we don't talk about it, it won't happen. And our numbers are showing that is not true.
Right. Because it's still present, whether we talk about it or not.
Absolutely. African Americans and Hispanic individuals as a whole continue to experience an increased rate of HIV infection.
And that's because for different reasons. One, because they're not talking about it and they're not educating themselves surrounding.
Correct.
And I know that it can the HIV it can be transmitted through needles and things like that. But when we look at STDs, and in comparison to STDs, where does HIV and AIDS rank in the Black community?
So I'm going to put those together. I'm going to separate those two, because normally we find HIV diagnosis because we're testing for something else. So either one, a patient has become so sick that they can't figure out what it is. Had a young girl in her 17, 18 years old, kept coming in for flu-like symptoms, finally tested, and it was HIV. So her body could not fight off the influenza. So normally when there's a diagnosis, there's a co-diagnosis at the same time. So STDs, STIs are still high. We're here in Marion County. Marion County is still too high on the list for syphilis and has been in the top 10 percentile of syphilis for probably 20 years now. And so the lack of utilization of protection is still high. And so our HIV connection to STIs is normally there's another STI at the same time of diagnosis. And then those come in incredibly ill that have already got their viral load so high that they're in AIDS. It's normally not an STI. It is something else that has gotten them in because they are incredibly ill.
Yeah. Wow. So I know that, well, you've mentioned the HIV and sometimes it's something else that maybe they've gone in for, and that's when it's noted that they have HIV. So, again, going back to the CDC, I know that it states that there are some STDs associated with HIV. Do you know what those STDs are, and what is the probability, which you've already kind of touched on this, but probability of people with those STDs getting HIV?
So for me, I try not to separate the two because I want people to understand that risk is risk. So if you are feeling any discomfort, I want you to go in and ask for a full STI panel. And that panel will include a blood draw for HIV. If they're not doing a blood draw, then they're not doing an HIV test. We're comfortable and we're used to asking doctors to check us for, there's an odor, there's a discharge. But if there's an odor or discharge, if there is, or you believe that there is an STI, go ahead and take the leap and ask for the HIV test. Because the sooner we can get you treatment, the sooner we can get you undetectable. I share that, AIDS used to be a guaranteed death sentence. It is not. It is a chronic illness. So we treat it today like we treat hypertension or diabetes. If you stay on your medications, you'll live a long, prosperous life. When we talk about fear of doctors and hospital systems and compliance, people of color are not compliant with medications. If I'm insulin dependent, I will take my insulin after I eat my cake. If I have high blood pressure, I'll take my medicine after I get a headache. HIV medications must be adhered to strictly. They need to be taken daily, preferably at the same time, to keep that virus suppressed. If we don't take it the same way, same time, every day, and that virus comes out of suppression and it's detectable again, it might affect the medications that we can give. And so instead of taking one pill, you might be on 4 pills because that one pill might have been 2 medications. And so that regimen looks different for each individual. But the compliance and the adherence to it is so critical because you can live a high-quality life if we just go back to taking those medications on a consistent basis.
Gotcha. Okay. Can you talk about prevention? Prevention of HIV and if there are any challenges in the community that the community faces with prevention?
So around 2014, 2015, we started utilizing PrEP, which is pre-exposure prophylaxis. So prophylaxis is what we consider this medication treatment for HIV, and we started using those around 2013, 14, 15. There were some tests, but it is now readily available. It was initially given to gay men, but the prevention is effective for everyone. It is actually the same medications that you would get if you were HIV positive, but because you're giving them in low dosages and they're tracked by a medical provider, it prevents it. And so there is no cure for HIV, but there is a prevention method. And so PrEP does work. And I think when you ask again, like, what is the barrier for people of color? It's trusting the system. Why would I go in and get medication when I don't have HIV? Or why would I go into a place that serves those with HIV? There's a stigma around that if I'm not HIV positive. Same thing with, like, I mean, it's the same answer around birth control. Why do we have so many, children who end up in homes where they're not desired? Well, we don't use protection. So the same protections are available. There's a medication. There's condoms and things for just STI prevention. But there's also, like, birth control. Birth control alone does not prevent HIV. It stops pregnancies. And so the same vigilance we put on pregnancy, we need to put on PrEP. There is now a tool that is available that allows us to stop the spread of HIV.
Okay. You said there is now a tool?
Yes, so the PrEP medications will prevent HIV. And so there is now a way to stop the spread, yes.
Okay.
And so it can be used in marriages. So if one person is positive and one is negative, then we would suggest that in any couple that the other person takes PrEP to make sure they stay negative. It can be used in those who have risk behavior. So if you're utilizing drugs intravenously or having multiple sex partners or having sex unprotected, PrEP is for anyone who feels like they're at risk or high at risk for positivity. And so it prevents the spread of the virus.
Okay. I know you mentioned earlier about Indianapolis being high in for syphilis, and it has been for, I think you mentioned, about 20 years. In comparison to, I guess, other states, cities, locally, even countrywide, as far as the AIDS in the Black community, how does the Black community compare nationally, or within the U.S.?
Yeah, we're probably on trend in our size. So the federal government funds support for those living with HIV and AIDS based on the number of positivities. And so we're at a level that is called a transitional grant area. We're big enough to have supported at I think there's one level above us. So we're not at like New York levels, but compared to cities our size, we're around the same, and our geographics are around the same. We have like 49% of our positivities here in Marion County are Black, and then 11% are Latino, 31% are white. But when you think about our state, that gets screwed because Marion County is such a predominantly Black county. So Marion County itself and the counties that are touching the county is probably more like a city that you would see our size. So Memphis or Cleveland or someplace like that. Like we're on target with our numbers around the same as any city. But you can't look at us at the state level because that percentage decreases because the state is not as Black as Marion County. But for people of color, it is still high. 49% of all positivities in Marion County are us. And so that is still alarming when you consider that around the state, we're definitely not 49% of the population.
Right.
But for our prevalence in Marion County, that is a high number, but it's not unusual for that number to be that high in urban areas.
Okay. Let's talk about, and I know you kind of alluded to a couple of things earlier, but what are some common myths about HIV?
I think
in AIDS?
The easiest one is it won't happen to me.
Yeah.
Number 2
Yeah.
is for gay people.
Mhm.
And number 3 is for white people.
Mhm.
And I can tell you that
So-
all those things are not true. When you look at females, 84% of our females, almost 85% of our females get HIV or report their transmission through heterosexual intercourse.
Okay.
So I can be a heterosexual female. I can believe that I am with one partner. But if my partner lives in that place where he is a male that has sex with men, and he is at 59% of men, that affects the number of positivities for women. So that myth is out the window. It is not for any gender-loving group. It is about the risk that we take.
Right.
Another myth is I can catch it by being in the house with you, or utilizing your fork or spoon, or laying in the room with you, or sitting on the couch with you. Those things are not true. It is direct bodily fluids, and they have to be at a rate that is high enough for it to transmit. So you should have seen, or there's a new advertisement around U equals U. If I'm undetectable, I can't transmit it. And so our goal is to treat HIV and to get that individual undetectable. So it's almost like cancer going into remission. We want the virus to be in remission in your body, and if it's in remission, you can't transfer it. Is the philosophy behind that U equals U. And so one of the biggest myths is that if I have it, my partner will actually end up with it. Like I said, we can use PrEP. We can get that person undetectable, and together with those two things, no, your partner is at no more risk than anyone else, because that undetectability, we cannot find the virus. It's such a small amount of the virus in the body that we can't find it. And our goal is to get, to continue to treat it as a chronic disease and not a life sentence. So if we can get people to stay on their meds, take their meds on a regular basis, and use the PrEP medications that are available, we could actually end this epidemic. It is still considered an epidemic in the United States. By 2025, there are multiple cities around or grant areas around the country that are working on a grant that's actually called Ending the HIV Epidemic. Marion County and the counties we serve is one. So we have state support and county support on ending an HIV epidemic. And it's concentrated on doing just like we're doing tonight, having these conversations in spaces that are not usually had. I grew up in the church, and so this is not a space that normally would have this conversation. But it's so critical that we have it, because we are still serving individuals that worship in every congregation, in every culture. And so it is not something that we can, as a church, continue to ignore, because we still have individuals that we love and are part of our fellowship that are positive. And so education, and then prevention and treatment.
And one more time, because I missed the name, you had mentioned the name of an organization.
So here in Marion County, there are multiple organizations. Those that actually treat individuals with HIV and AIDS, like are the medical providers, are our major hospital systems, which are Eskenazi, IU Health, Community Health, and then the Damien Center here locally treats those living with HIV and AIDS. And then we have agencies that support that work, that don't do the medical care, but do support that. And there are several that really focus on people of color. One is Brothers United, which is more widely known in the area, but it's called Beauty Wellness now. And then there is Women in Motion, who does prevention, education, and testing. And then we have Trans Solutions, which works with those that are living either transgender lifestyles or non-binary lifestyles.
Okay. And what I'll do, I'll make sure that I make note of these and just share them after the show.
And I can get you the link. I'll get you the link to make sure you have them.
Okay, I appreciate that. I did read where they have like World AIDS Day, which is I believe coming up in December 1st, and then there is like National HIV/AIDS Awareness Days throughout the year. So, what do those involve, and how can the community come together and get involved in those nationally and locally to try to help reduce this rate of HIV and AIDS?
Thank you for bringing that to light. So World AIDS Day is December 1st every year. It is a day that we recognize those who have passed on from the disease or complications from the disease. And there are multiple spaces of remembrance. The quilt that normally comes out, and I can't remember where it is this year, but there are multiple places of remembrance. And there's testing across every city, state in the United States around that day. Again, it's World AIDS Day, so it is international. I can't remember if President Biden did it last year, but we've had presidents put the red ribbon up on World AIDS Day to recognize those that are living with HIV and AIDS and those who have passed from complications of AIDS. Just a symbol of understanding that our country is still fighting this fight with us. And so that is World AIDS Day every December 1st. And then throughout the year, there's different days that recognize different aspects. So February, we focus on African Americans and testing and awareness. June 27th is HIV Testing Day, which is done, again, across the nation. It is just a day that we test anywhere. But we've gotten so progressive that any day, anyone can get tested. Testing takes 1 minute to get a preliminary test. If we see that there's a reaction, which means that there are antibodies in your body, then we'll send you to get a blood test and we'll do a confirmatory test. And so if you can think of Black History Month, Hispanic Heritage Month, Native American Month, anytime that you see an awareness month, there is concentrated efforts around that same time for those individuals to be tested. But I don't want anyone to get caught up on the dates. I think that the biggest thing, we do recognize World AIDS Day, but the biggest thing is that there is now the availability and the freedom to get tested in multiple places. Women in Motion does girl parties or testing parties, and so if you wanted to have 5 or 6 of your friends come over, they'll come over, do education, talk about prevention, and then offer testing to those who want to be tested. So we are moving in spaces that are just unusual. So a girls' night in or out could actually be a testing party to make sure that those that are at highest risk, because again, I told you women of color are at the top of that list of prevalence, that we could come into your space so you don't have that stigma of figuring out where to go. But at any given time, testing is available. Hospitals will test, and when you go to get your annual physical, asking the doctor to test. I just went in May, and every year my doctors now wear, common, and it's common for me to ask, but every year I ask for that HIV test. Not because I don't know what my status was last year, but I think it gives him good practice of making sure he is offering that, because when I had my last child, the doctor was hesitant to give me a test, which was ironic for me because, it is now standard practice to test mom in first trimester and third trimester during a pregnancy. At that time, it was not common, and we had to ask for the test. And so my doctor was just hesitant to give it to me based on my marital status, my insurance status, and other stigmas or stereotypes that she thought based on my demographics. And I think that's important that we push providers sometimes to make sure that we are asking the hard questions because it is our bodies, and we need to know what we're dealing with so that we can continue to suppress the viral load of our community.
Right. And I appreciate you bringing that up because I know at one point that when you went for your annual physical, that that the doctors would test for everything else except for AIDS and herpes. And you would have to ask your doctor. So it's like all those times, you know, I would ask, and even though I'm not active, you know, I still want to be tested for everything.
Exactly.
And I didn't realize, oh, they're not testing for AIDS and herpes. Okay, can you do that? You know, because I know things, they can lie dormant and then just pop up.
And so I'm glad you brought that. So when we talk about like a late diagnosis, a late HIV diagnosis is defined as having AIDS within 3 months of your initial diagnosis. That means that person's been sick for a while, and either we didn't catch it or they didn't come in for testing. And so, again, once you get to AIDS, can it be treated? Absolutely. Is it more difficult to treat? Yes. And so when we think about the stigma that was around cancer, I don't know if you remember, people would like whisper that someone had cancer, they had the big C or those type of things.
Yeah.
We're doing that same thing with HIV. And so, you know, you don't ask for a mammogram. No, you do ask for a mammogram. You demand your mammogram annually as your doctor sees fit. So the same persistence we have around cancer can be around our sexual health. And so, like you said, even if I'm not active, asking the question of the provider to make sure that I know that it, you know, what's inside my body and how it can be treated if there is something there. If you live in the United States and you have access to care, we have great providers across the country. We have great resources across the country. I do stigma reduction training for providers around how do we treat people that show up to make sure that we can keep them in care. And so there's just so much wealth of services that are available to those who are positive, but also to those who serve those who are positive. It is a benefit to be in the U.S. and have access to those because many countries do not. But knowing that our numbers are still way too high because we have great services, we're still missing the mark on education and testing. And testing before we know we're sick and not when we're starting to have symptoms and showing up ill and then having to get care to get us stable when we can prevent it using our PrEP or make sure that we're testing on a regular basis so we can kind of diagnose kind of figure out when the diagnosis transitioned.
Okay, Angie, I really thank you for the information that you've shared. And before we end, is there any advice or suggestions, recommendations that you would make for our listeners who might have questions about HIV or AIDS, or if they have any concerns? Any advice that you have that might be helpful that you can share?
I think the biggest takeaway is please don't be afraid to ask. There are resources, like I said, there are resources across this country that are easily available. And so if it's reaching out to you, Kelly or Steve, and I make the connection in another state, that is easily doable. Most providers are funded through HRSA, which is our federal government, and so the resources that are available are easily found. It's just making sure that we are consistently doing the same thing, which is getting tested and preventing. So, once we know our status, don't wait 5 to 10 years to get it tested again. Put it as part of your annual exam. If you're not getting annual exams, whenever you get in front of a physician, ask. Treatment is there, care is there, resources are there. But, as the Bible tells us, we have not because we ask not. And so don't let our ignorance or our fear of knowledge be the reason that we're the next positive.
Amen. Is there do you have contact information or an email address if someone wants to get in touch with you that maybe we can share with the listening audience?
Yes. So they can. I use my same email address and cell number for all entities. So if they would like to reach out to me directly, they can email me at anjeemoore44@gmail.com, or give me a call or text at 317-513-1883.
Okay. And I'll make sure I repeat that information. So again, like I said, Angie, thank you so much for being on tonight. This is, I know I say this with a lot of my shows, but it's an important topic, but this really is an important topic. Is dealing with people's health in their life. So I appreciate you being on tonight. If anyone in the listening audience wants to connect with Angie, if they have any questions, please feel free to contact her at ANJEEMOORE44@gmail.com, or you can send her a text or call at 317-513-1883. As she stated, there are multiple resources available across the country that you can look into, and I'll make sure that I post those resources online. Also, just keep in mind that it is really important to educate ourselves, to have discussions, and like Angie said, not to be afraid to have these conversations in our homes, with our families, with our friends. It could be a matter of good health, bad health, life or death. So, again, thank you, Angie, and I want to thank Brother Stevie for this platform and allowing us to have this conversation tonight. And without anything further, I will turn this over back to Brother Stevie. Thank you so much.
Thank you so much, and I appreciate you guys taking the space to have this conversation.
Yeah, thank you.
Hey, this is Genesis Archer, and you're listening to A Talk with My Sister on What a Word from the Lord radio show.
You're listening to What a Word from the Lord radio show.
It ain't easy, no. Sometimes it gets hard down here, Lord. Sometimes it gets rough, so rough, so rough. Sometimes it gets tough for me. Has anybody been lonely all by yourself? Has anybody been sad, broken hearted and sad? Have you even been mad? Oh, you had to cry all night long. I know it's hard, but what you need to do, you need to wait.
You're listening to What a Word from the Lord radio show.